With Richard Mansell, who we have just wrapped up our wonderful lung cancer town hall in Tampa, Florida. Richard lives in Tampa, and wondering what you thought of the whole thing.
Well, I think that these kinds of sessions are absolutely outstanding. I can just feel this whole audience being uplifted in hope and in survivorship and getting the message from all these professionals. I mean, it's just opened medicine up tremendously. They want you to know everything. There's no more secrecy, as you used to be never told what was going on.
Well, it's a different world, we know, with doctors and patients in that relationship. But your wife is the one suffering from lung cancer.
She's the one that had the lobectomy, and
she looks great.
She does, and she's having CT scans every 3 months. And she's had her chemo, and so we're just living day to day as they tell us.
So what is your message for patients who are either on the fence about a program like this or educating themselves, going to that medical school that Dr. Carbone talked about?
Number one, it is a day after day after day. This becomes your life. This becomes your job. Number two, you're not going to die this afternoon, so you do have time, as they mentioned. And number three really is advocacy. You really must be an advocate for yourself, and your family should be one too. And you want to get the best care you can get. And you must be patient. And my biggest excitement when I was turned loose back 10 years ago was I'd be left alone. But they had a survivorship program here, which I'm in. So I never lose contact, because that's a scary thing, to be divorced from your past like that.
And maybe that's the most important message of all, the communication, not just with your healthcare team, but with people in your situation. There's an awful lot of support and advocacy that you can, and strength that you can gain from each other. I'm Carol Preston, and please remember that knowledge can be the best medicine of all.